Hey, Untamed television fans, how you doing? I'm your host, Craig Bielek, and man, listen up. I'm serious. Men, listen up. We're going to talk about your health, specifically men's health today with Dr. Bradford Stevenson, who is a urologist with Ogden Clinic. Great to have you here. And I started out with saying, men, listen up, because as you know, men are not really all that great at paying attention to their health.
Right.
And that's one of the reasons we're here today to talk about it. And we're here to talk about something that's close to my heart, or actually a little closer, a little farther down. Yeah, about heart, 26 inches from my heart or something like that. We're here today to talk about prostate health.
Yeah.
And and again, this is close to my heart because I'm a man, 56 years old. Mm-hmm. This is about the time that men start experiencing those kind of problems.
For sure.
Right. So let's just start with the basics, okay? Because there's a lot of guys out there that have heard about their prostate, but maybe they don't know what their prostate is. I mean, where is it? What does it do?
Right. So that's typically the first question I get when we start talking about prostate. Like, what is the prostate anyway? So the prostate is a gland that sits at the base of the bladder. You can think of it like a donut, and you pee through the donut hole.
Right.
Is the way that it works, and its primary function is reproductive function. So once guys get into their 50s and 60s, reproduction isn't really a concern for them anymore, and then the prostate unfortunately just starts causing trouble at that point.
Oh, okay, so he's unemployed,
yeah,
and all of a sudden he's got time on his hands, and so he starts getting into trouble.
Right, exactly.
So what kind of trouble? I mean, what does trouble mean for prostate?
Well, so there are two main things that can cause problems with the prostate. One of those is prostate cancer, and so that's an important thing for guys to follow up. Get regular checkups with their physicians, their primary care doctors, and that's the dreaded rectal exam is part of that.
Right.
And then what's called a PSA test, which is a blood test, and that's to screen for prostate cancer. Mm-hmm. The reason that's important is because you don't know you have prostate cancer. You don't have any symptoms from prostate cancer until it's really grown out of control.
Right.
So that's the number one thing. Number two is that and it's probably more common than prostate cancer, is that the prostate, again, like we said, you pee through the center of the prostate. There's a channel that goes through that. And as men age, the prostate grows, that channel gets tighter, and then it causes you trouble peeing. So that's called BPH.
BPH.
Yeah, so that signifies a benign or non-cancerous enlargement of the prostate.
Okay, so just because you have an enlarged prostate doesn't mean that you have prostate cancer.
Right, correct.
It could be something else, or it could be. But that's why that's important to have those two tests. Like you said, the dreaded digital with the finger, and then the blood test, which is the PSA, which tells you if you've got an elevated level in there. So you start mentioning these symptoms. Okay, so I'm a guy, all right, and I'm at that age, and you say, you're going to experience some symptoms. My dad used to call it rusty pipes.
Right.
All of a sudden.
It's a good description.
Yeah, you're having trouble. Maybe you're urinating a lot. Maybe you're having trouble. So let's start. What's a lot? I mean, what does that mean?
So the prostate grows slowly, but it does grow. In some men, it just keeps growing and growing as you age. And so, you said you're in your 50s, and that's about the time the guys start noticing problems with it. And it comes on at first slowly. You notice, my stream's not quite as strong as it used to be.
Yeah.
Guys will say, I used to be able to write in the snow. I write my name in the snow. I can't do that anymore.
I have to settle for initials.
Yeah. So initially it's just a change, but it's not really bothersome. And then as the years go on, that stream keeps getting slower and slower. Maybe it takes a little while to get started. And then, like you say, a secondary issue there is that because that bladder's having to push so hard now, you got a tight channel, the bladder's got to push harder to get through that channel, the bladder starts getting irritable. And so you start peeing more often, you can't make it through a movie anymore, you got to run to the bathroom, you're maybe waking up at night to go, and that's all because that prostate's just squeezing down that urinary channel.
Right. So, at that point, okay, so you've gone to your doctor.
Yep.
And he says that you do have, or maybe they've gone to you, and you do have BPH.
Right.
So the prostate's getting a little larger. It's causing you some problems. So, you're stuck with it, or what? You can treat it.
So a lot of guys just say, it's just part of getting old, and it is part of getting old, but it doesn't mean you have to like it or that you have to live with it, right? Because we can treat it.
Yeah.
And so the biggest as long as you don't have prostate cancer and it's just the urinary symptoms, if it doesn't really bother you, then don't do anything about it. You know, it's generally not a health concern unless you can't empty your bladder and you start getting back up into your kidneys and stuff like that. But for some guys, you know, waking up one time a night, it doesn't really bother them. They'd rather just kind of let it be. But if it does bother you, there are ways to treat it. And they're basically, you either take medication for it or you get a procedure to shrink it down.
Okay, so you start with the medication, and that's pretty easy, right?
Yeah.
There's a number of them that are out there.
Right.
I can't remember any of their brand names, but
Flomax,
yeah, there you go.
We got the
we got the
waterfalls in the
behind us.
background.
Yeah.
Good flow. So
Yeah.
so that's how you remember the names of those medications. Flomax, Rapaflow. They'll get you flowing. That's the whole idea.
Right, and they might work for a while, they might work forever, but eventually they probably will stop working.
Yeah. So your prostate can't outgrow the medications.
Okay, then what?
So then you talk about things to either shrink down the prostate or open up the prostate, the channel. Now, forever there's been the procedure called the TURP. Some guys know that as the Roto-Rooter job or a ream job.
Yep, I've heard those.
Heard that?
None of these terms sound fun. I mean, none of this sounds good.
And that's why a lot of guys don't come in to the doctors, because they're like, I don't like the idea of any of this, you know.
Yeah.
And so they avoid it until it gets really bad. So the TURP, or the is what's been around forever, and that's basically an in-hospital procedure. You go to sleep for it, and then a urologist like myself will go in and actually basically like core out the inside of the prostate by trimming out that tissue.
Right.
So it's actually removing tissue. Now that works great to open up the channel, but you got to go through a bit of recovery. You know, so you're in the hospital, you can have some bleeding, some discomfort as you heal up.
Yeah.
So there's a new procedure that's only been out for a couple years now, and we just started doing it recently in the last 6 months here at Ogden Clinic. We're actually the first ones in the state to offer this procedure. It's called Resume therapy.
Resume.
Yeah, Resume with a Z.
Yeah, but I like that better than TURP.
Yes.
I mean, TURP or Resume.
Yeah, Resume or Roto-Rooter. So,
right. So it's not a Roto-Rooter. What is it then? I mean, I don't
So
understand.
this is a procedure that shrinks the prostate by using steam, so heated water vapor. It's done in the office instead of in the hospital and under anesthesia. It's an office-based procedure that you don't have to have anesthesia for. And the way it works is we perform a scope. A small camera goes in to look at the prostate, and you can poke a little needle into the prostate, and you deliver hot steam to the overgrown parts of the prostate. And what that does is it pops those cells. It basically breaks them, the heat does, and then your body's natural mechanisms reabsorb those broken down cells, that broken down tissue.
Wow.
And then what it does is it shrinks that channel open.
On that. So, and you've done this. I mean, you've done procedures on this. How do men like it? Do they recover well? Is it an easy thing?
So it still doesn't sound that pleasant. But we give guys a little bit of sedation, you know, kind of like going to the dentist when you're kind of sleepy, you don't really care what's going on. We give you some sedation, we give you some numbing, and then the procedure itself is a 10-minute procedure. And then guys go home right after.
So no overnight hospital stay.
No overnight hospital stay.
Kind of in and out.
And guys have recovered really well from it.
Wow. That's pretty amazing. I mean, I mean, like you say, it doesn't sound all that pleasant, but come on, you know, compared to everything else.
Right.
So, when do you really start worrying about prostate cancer with a guy?
So the recommendations currently are, at 50 years old, you should start talking to your family doctor about getting screened. So that's, again, the digital rectal exam and the PSA check.
Well, what if you're a guy like me who has a history of prostate cancer? My grandfather, great guy, unfortunately, he had prostate cancer and may have passed that on to me. Should I come in earlier than 50? Or what do I do?
For sure. So for populations that have an increased risk of prostate cancer, so like example, if your family, your dad, your grandfather had prostate cancer, then the recommendation is you start checking it out around 40 years old.
Right.
So
and there are treatments for prostate cancer.
Yeah.
Also.
Yeah. So prostate cancer, even though it's a bad disease and it's the #1 cancer in men, it's a treatable cancer. So if you catch it early enough, you can treat it and not have any recurrence in the future, or a very low chance of recurrence in the future.
Wow. That's great. It's great. Men, I hope you've been listening to this, because this new treatment, Resume, I got that right?
Yep.
Resume sounds like a much better way to get this done than the older treatment. And I know men that had the older treatment, and some of them had problems and everything. I mean, it was better than just suffering and staying with it, but Resume sounds a whole lot better, and Dr. Stevenson would be happy to help you out with that. He's happy actually to help you out with any of your men's health needs down there. Yeah. Okay, because as we age, we all start to experience a little bit of problems in that area, and give Dr. Stevenson a call. You can find him. The website for Ogden Clinic is
ogdenclinic.com.
Right, and you can also find him at brighamcityhospital.com or ogdenregional.com, 2 Mountain Star hospitals that I'm familiar with.
Right.
And he's waiting. He's waiting right now for your call. He's he's right there. Right. One last piece of advice for men about their health down there. What would you say?
I'd say just, like men tell me all the time, it's just part of getting old. And it is part of getting old, but you don't have to live with it. There are treatments for all sorts of issues related to aging that can make your life better.
Yeah. So it's like gray hair. It's like it's part of getting old, but you don't have to live with it. You can color it.
That's right.
Says the gray-haired guy that hasn't colored his. Dr. Stevenson, thank you for joining us again. Dr. Bradford Stevenson, a urologist at Ogden Clinic, and thank you for joining Untamed TV. I hope this has been informational for you. And men, you should have been paying attention. Women who are watching, pay attention to your man and whop him on the head and tell him to go get checked out.
Right. Thanks.
Thank you.
Appreciate it.
You bet.
Untamed TV. Untamed.